Take a look at what? Reticulocyte. That's today's topic, and it's a fancy long word for baby red blood cell. Now, in healthy individuals, this is a word that we would likely never have come across. However, in the land of sickle cell, it's a frequent word we talk about every single time we go to the doctor and have our labs drawn. Reticulocytes refer to baby red blood cells, and in a regular healthy adult or child, your reticulocyte count is usually below 1%. That is measuring just how many new red blood cells your bone marrow is cranking out. Now, this level is in direct relation to how long those healthy or unhealthy red blood cells are living. Remember, we talked about sickle cells only live between 10 and 20 days. So that bone marrow is having to work, just as harder, that much harder. So your reticulocyte count, or the amount of baby red blood cells being produced, goes up. The more sickle cells that are roaming your body, the higher your, what they call retic count will be. So if you are a person living with sickle cell, or you have a family member or a friend with sickle cell, and you look at their lab tests, pay attention to the retic count. That's what it will be called on there. And compare it. The average person is somewhere below 1%, and people with sickle cell have a huge range, anywhere from 6% on up to 40% for their baseline, depending on the type of sickle cell they have and whether or not they're experiencing any kind of crisis that's causing their red blood cells to die faster. Doctors often measure the intensity of a crisis and the effectiveness of your body to work through it based on what your reticulocyte count is. So if you are in pain and that retic count is not going up, and your body is not sending that message to the bone marrow, then that triggers a problem that there seems to be some confusion. If your reticulocyte count goes really high, that means that your bone marrow is doing an amazing job in keeping up with the problems that are happening because your red blood cells are dying off faster than normal. Stay tuned tomorrow when we talk about aplastic crises, which is when your bone marrow doesn't receive that message. Check us out on the web at hopeforscd.org and leave any comments or questions below.